The one thing you can expect in a healthcare career is change. In order to be successful, you'll need to understand which areas require your attention as you gain expertise in your field. This presentation will review a few of the newest and most exciting trends in healthcare informatics that may affect you on your journey and possibly change the pace of your career. The first example of an emerging trend we will use to demonstrate the potential of healthcare informatics in the future is 3D printing. 3D printing is a revolutionary technology with endless possibilities in personalized medical solutions. 3D printing has capabilities to print high-end metallic implants and instrumentation used for surgical applications. This manufacturing technology ensures perfect fit and function for personalized prosthetics and orthotics. The cosmetic firm L'Oreal has confirmed they are able to 3D print human skin, which could provide benefits for burn victims and those suffering from skin conditions. Research is currently being conducted into the possibility of replacing the complex organs that sustain our bodies. Personalized joints and bones can also be produced. 3D printing has obvious potential in the medical field, most of which we have yet to discover. But the healthcare industry is already benefiting immensely from this relatively new technology.
Mobile applications aren't just for fun anymore. While many people are tweeting and Instagramming social activities, healthcare and industry innovators are merging the technology into tools for healthcare providers and consumers alike. An article from the Associated Press in September of 2015 spoke to the 165,000 healthcare applications available to consumers. While there are many to choose from, around 36 of these applications account for nearly half of the health-related downloads. The Institute for Healthcare Informatics revealed that consumer health apps for the iPhone iOS has increased twofold in the last 2 years alone, pushing the number to 90,000 healthcare applications available. While consumers are utilizing apps for dietary management, fitness, weight loss, self-diagnosis, health condition tracking, and education, among many other needs, healthcare providers and organizations are recognizing this emerging technology as an integral part of meeting patient needs. The number of exciting new apps is too long to list here, but these are a few that highlight the broad spectrum of emerging uses. On the far left is the new app and cell phone case Alive ECG from AliveCor. With this combination of application and phone case monitor, a person is able to record a real-time electrocardiogram anywhere. It is currently available for iOS and Android, and beyond providing an ECG in 30 seconds, it can also be used to track symptoms and health habits. The results can be easily shared with a patient's healthcare provider, leading to intervention if necessary. Alive ECG has been cleared by the Federal Drug Administration. The app download is free, and the handheld ECG attachment may be purchased for as little as $74.99 on the company's website. Next is the OtoHome from San Francisco-based CellScope. This $79 device and app work with iPhone 5 and 5S through the camera and recording functions. Once the Oto attachment is inserted into a child's ear, an eardrum finder directs the user to pertinent visuals inside the ear. After recording and symptom data is entered, the information is sent to a remote physician who will respond to parents within 2 hours, possibly with a diagnosis and prescription sent to a pharmacy of choice. The first physician consult is free and $49 thereafter. A physician or professional-grade version of the system is available for $299, with a second generation available for pre-order. This last example is a tech approach to connecting the interdisciplinary care team. CareBook from Zinx is a HIPAA-compliant communication tool used across the continuum of care. From the time a patient presents to the emergency department and the duration of the hospital stay, through post-acute care rehabilitation and on to home care, the entire care team is connected via mobile app. Among a multitude of customizable features, communication includes real-time texting and addressing tasks to be accomplished. Whether respiratory therapy, dietary, or home health nurse, each provider keeps in the loop. Accountable care organizations are utilizing this tool to promote smoother care transitions and to prevent unnecessary rehospitalizations.
People shouldn't have to suffer through a bad habit or a bad situation. There should be these things that we can wear that can help us gain insight into our problem and perhaps insight into a whole disease category.
With wearable technology, we're going to get so much data about what people's lives really look like, what they're really doing, whether they're really taking their medications or really doing their physical therapy. And there's going to be a totally new relationship, I think, between doctor and patient when that happens.
There's very specific needs that people are going to have that wearables can solve that's different than the general purpose kind of problems that a phone can solve. For instance, if I have back pain, there's wearables that are very specific to addressing that problem.
Wearables can remind you that you've been sitting for too long. They can let you know that your posture is bad. They can let you know that you fulfilled your 20 minutes of exercise that you had to do.
There is a wide variety of wearables for public use. We will be focusing on Google Glass. Take a moment and look over the advantages and disadvantages. Technology has come a long way over the years, starting clear back in the 1200s with eyeglasses. Let's take a look at this YouTube video of how a doctor uses Google Glass to enhance, improve, and provide the best advanced medical care during surgery, not only for the patient, but to reach out to students and colleagues across the globe.
Dr. Christopher Kading donned Google Glass and for the first time transmitted a point-of-view operation to audiences miles away. As Kading performed surgery on the east side of Columbus, a colleague collaborated from his office across town. And on Ohio State's main campus, a group of medical students saw this historic event from a completely different perspective. Beyond being a teaching tool, the device could actually assist during an operation. A surgeon could potentially call up x-rays or MRI images of the patient, pathology reports, and reference material. The doctor can even talk live to colleagues or specialists via the internet anywhere in the world.
Google Glass, as well as all wearable technology, needs to ensure the privacy and confidentiality to their users and to the security of their personal health information. It is vital that patients are educated on the potential risks of wearable technology. As clinical nurse leaders, we play an important role to ensure the security and privacy to all within our care.
The concerns and ethics with emerging trends, you have the patient that may have trouble trusting technology due to the idea that their personal health information may not be kept confidential, and maybe the thought of healthcare becoming impersonal. Then you have the tech-friendly patients that will embrace new technology, such as the ability to access health records through their mobile devices. Healthcare professionals may find informatics frustrating, confusing, and maybe even exhausting, not realizing that informatics offer decision support, performance accountability, safety measures, and an ease of use. You then have the debate of parents needing consent of their minor child to release their protected health information. Where are we going? Now we have the EMR, smartphones, telehealth, 3D printing. The patient has the ability to converse face-to-face with their MD without even leaving their home. We have 3D printing capabilities, mobile apps, active ECG, auto home, care book, and wearable technology. Technology is great and has a bright future in healthcare. We as healthcare providers, patients, and physicians just have to embrace it.